Now what we learned about the salivary glands, the mucous glands of the oral cavity, then oropharynx, then pharynx, these. Now they are having some layers. Now the food has to be propelled. It has to go down. It goes down. That means there should be a muscular to push that muscle tissue. Now the muscle is in the external. It's a tube. It is in the external. Then you slowly go, it's a tube, naturally from external to internal or internal to external. So internal you get epithelium, squamous epithelium. Now the epithelium rests on the your submucous, and there are glands there. There are vasculature, blood supply is there, and then the muscles come. Now, what type of this thing you'll get? Stratified, non-keratinized squamous cell epithelium. Stratified, like stratification. Now, non-keratinized. The keratin layer is not there. Now, the skin has a keratin layer. Get it? Now, there is chances of ulcers in the gastro, as it's entering the stomach, gastroesophageal junction. Now, gastric acids. Now, if anyone is suffering from gastro, like acidity, hyperacidity, then what happens? Sometimes there's a gastric reflex, gastroesophageal reflex. That repeatedly, or is an alcoholic or even non-alcoholic, a person like me even have hyperacidity or something, reflex sometimes. Now, that area is more vulnerable for your ulcers, and it's exposed to this thing. But even the greater curvature, lesser curvature is even it's peptic ulcers and all. But it is not due to only the gastric ulcers or duodenal ulcers are not only the concept of that hyperacidity is this thing, but it is a H. pylori bacteria. In previous days, when we were students, then H. pylori bacteria was not discovered. So, any ulcers or anything, any operation has to be done, then there different procedures are there that you will read in surgery. But there is repeated any give you trauma like this, like this, like this. Or you see the Muslim, they go for a namaz. Okay, when you see they are getting black over here, because they have a forehead and touch the ground. That's repeated. You have you sit in the ground, some callus. I'm just trying to correlate. Correlate means repeatedly some trauma or pressure is there, but there's no pressure is there. But I'm telling you, repeated any this thing can cause injury. It can be minor, it can be major. You order for a starter in Peter Cat, Park Street, on Christmas or New Year. Now cello kebab and all this, and you're a bit of some drink, okay. Your repeated exposure, trauma to that area can result in some ulcers. And if there is this thing, then you do go for a GI endoscopy. Now, if you do GI endoscopy, then you have to see the gastroesophageal junction. mostly that slowly, throughout the esophagus, the scope is passed down, and there might be some ulcers there. And Barrett's esophagus. Now that is, they take a biopsy from there. Biopsy. Biopsy means for biopsy, the term, you take the tissue, then process in the formalin or fixative, whatever you are using, and then ultimate you getting a slide. That whole process is known as biopsy, but we loosely have come to know like X-ray chest, X-ray spine. That is your, but it's a radiograph of chest. So these small words doesn't matter, but I'm telling you this is that is company or X-ray chest. It's like that. Now you just see each. You have my 2 books are there. If you have not bought the books, you see, and you see the slides of 3 slides. Don't break it, please, because I will be lost. Because you cannot get good slides nowadays. Even if you pay for it, you don't get it. So please see them and view. Go back, send your friends. You sit in the class, see books, whatever it is. Mucosa, submucosa, and then muscular mucosa, adventitia. You just see, this is for your histological drawing, you do this. Now this you view, whatever you are seeing there, you will view there. Dakho. Nothing, this thing. Eta dakho, arekta, hey, ekhane dakho, khata, boi. Dekhe nao, dakho. Eta hocche mucous layer. This is the submucous layer. These are the glands, okay. This is submucous layer. This is the mucous layer. This is submucous layer. This is the muscles. Now these are muscles are like this. So when the TS section is cut, then you see that. Now mucus, submucosa, muscularis externa, lamina propria. Then you get your mucosa, esophageal gland, stratified, squamous, non-keratinized epithelium. Chalo. By the time you view, ekhane hate eke nao, chobita eke nao, roughly. Dekho na, mucosa. This is the mucosa. Stratified, squamous, non-keratinized. Lamina propria, the muscularized mucosa. This is the glands, esophageal glands. These are the inner circular layer of muscles, outer longitudinal layer of smooth muscles. And smooth muscle is covered by connective tissue. Please interact, see, যত view করবে তত তোমার চোখটা ট্রেন হবে দেখে নাও on. Now you see this actually is now you take now এটা
ওইখানে তো এইগুলো দেখা যাচ্ছে না।
এই গ্ল্যান্ডগুলো দেখো, এখানে তোমার ইয়ে হয়েছে তো, এটা এই দেখো একটা পোর্শন আমি এরকম করে ধরলাম। ওকে, নাও ইউ সি now you see it is here in between